Hi, I'm Erica Lindquist, Senior Director of Business Acumen at NASWD, the National Association of States United for Age and Disabilities. I'm pleased to represent the HCBS Business Acumen Center. I'm joined today with Deborah Scheit and Natasha Young from the United Disabilities Services, otherwise known as UDS. They're here to tell us a little bit about some business strategies that they've implemented at their organization. So before we go too far, first tell me about UDS.
Well, UDS is about 50 years old, and we are a multifaceted organization. We are a nonprofit and we're mission driven. We exemplify servant leadership all throughout our organization, which I'm very proud to say. I've been with the organization about 2 years now, and we have about 350 employees total, and we operate in 40 of our counties in the state of Pennsylvania. We are here representing HCBS, Home and Community-Based Services. But we also do such things as service dogs and ILS, which is our PAS, Personal Assistance Agency. We do adult enrichment programs, and we do home modifications. We do custom wheelchair fittings, durable special equipment.
A resource center.
And a resource center. We do person-centered counseling. We're a pretty big organization for an HCBS organization.
All right. Is there anything you don't do?
No.
We don't.
All right, very good. Well, the HCBS Business Acumen Center is really devoted to helping community-based organizations, and particularly those that serve people with disabilities, in advancing their business acumen, integrating their care with healthcare systems, or working with integrated care organizations, and just otherwise bringing their businesses to the next level. So I know that you've been up to some interesting things. I'd love to have you tell us about them.
We're very proud of what we've done for our outcome measures and the actionable items that we use to get us there. So one of our main outcome measures was to reduce unplanned hospitalizations, because it's not good for our participants to go into the hospital for obvious reasons. We don't always know the condition they are when they come back out, right? And it's also a cost-effective measure for the state. It's very expensive when folks are going into the hospital. So we decided, how do we start? Because we're working with social workers who have been used to, for most of their career, doing coordination of services, and now we're asking to do things a little bit more clinically complex. So we started with Natasha's group, because she's kind of out in the wilderness, almost, if you would say. She's out in an area with our very limited resources. So we started with emotional wellness. That was our way of getting our folks involved. And so in order for them to be able to do emotional wellness assessments, they had to be trained, and we had them certified in QPR training. And then I'll let you take it from there. What did you find? We pilot everything first, and so she started with the pilot.
So all of our staff became QPR certified in our pilot program, and we really started from there with a small group to see how it would work. We developed a way to track, and each coordinator would then go out to a home and do an assessment with our participants. And it really was a two-part assessment. So they're going out and they're asking questions on the assessment tool with the participant and engaging them to get further information about their emotional wellness and see if there are early indicators where we can step in and try to coordinate that with a PCP or therapy referral or some other resource that would meet their need to get that early intervention in. And that's kind of how it started.
Education as well, right?
Yes, and education was a big piece.
We used the PHQ-2, and if they answered positive to either of those questions, we went on to the PHQ-9, which is one of the most standardized tests that you can use. It's in the MDS, in the nursing home environment. It's in 30 different languages, and QPR training actually stands for question, persuade, and refer. So our folks really at first gave us a little bit of pushback, saying, well, we're not really all that clinical, but after they went through the training and they did it, they really liked what they learned. We gave them a algorithm, if you will, so they knew what to do when a person scored a certain level. But the best part was that nobody refused to take it. Our staff thought, oh, well, nobody's going to answer these questions, and they did, and they gave us a lot of really good information. But why did we start with emotional wellness, and how does that play into unplanned hospitalizations? So if you think about it, more of my presentation will give you more data on that, but if you think about that, folks that have a sad and anxious mood are probably going to be showing up at the doctor's office, at the emergency department, at the hospital more often, not presenting with a sad and anxious mood, but presenting with somatic complaints, because there are things that sad and anxious mood are driving. So if we can help to get them to seek help outside of going into the hospital, that's going to maintain a more healthy and a safer environment for them in their home.
So now tell me again, was this initiative one that you just solely chose to pursue, or were your payers or your healthcare providers asking for you to do this?
No, but we knew it would bring value to our payers.
And how are they responding?
Loving it.
Okay.
Yeah, they are. They are loving it. So from that, we went on to other initiatives as well. We went on to fall assessments. All of this is built on having the person-centered care. So the person is at the center of our care, but so is his PCP, right? So is the nurse practitioner. So is the rest of the team that we're interacting with. So as far as looking at hours, what are they truly based on? What natural supports do they have? How do we pull those folks in? We looked at high-risk participants. So one thing led into another, and it developed some pretty good outcomes. For example, we decreased our unplanned hospitalizations by 5%.
Okay.
Think about that. 5%, if you had 100 people, which 5% would represent in an organization our size, and an average hospital stay is 5 days, an average cost of a hospital stay is $2,000 a day. That's $10,000 a day per 100 participants. It's $1 million.
Yeah. And so incredibly good outcomes for the patients. Are you receiving some of the financial benefits from those cost savings?
Are we receiving, not in the way that you would think. The
Okay.
way that we're receiving the benefits is that we are growing so
Okay.
fast. We
Yeah.
are having customers come from us from everywhere wanting to be a part of our team. So as far as us getting higher reimbursement rates than somebody else, no, because we control our efficiency. Our rates are really good. I mean, our admin and travel time is about 12%, so the rest of that is our productivity time,
Okay.
right? But we have participants coming from all over. So just last month I had to hire 12 more service coordinators.
Okay.
So that's how it's growing.
Okay.
That's the benefit to us.
All right.
That's the sustainability. The bigger, the more people we can help, and
Yeah.
that's our mission.
You've established yourself as a solid partner with the healthcare providers.
Yep.
Very good. So what advice would you give to a community-based organization that was considering creating partnerships with payers or the healthcare
I think you have to prove it. I mean, figure out what your outcome is, and then divide it into what your strategies are. What are your actionable items? For example, okay, I don't know an organization that doesn't want to have staff engagement, right? So if you want your staff to be engaged with their next level you want them to be engaged with their job and be engaged with the organization. Those are your outcomes. What are your actionable items? They might be to make sure you have transparency and communication with the next level supervisor. Make sure that you have transparency and communication with the senior management staff. Make sure there's opportunities for advancement in career. Make sure that your team is seen as competent, because everyone wants to work for an organization that's competent. So another outcome of this has been that our turnover has gone way down.
Okay.
So, I mean, those things are very important to us, and that leaves a mark of who we are in the community.
Excellent. All right. Is there anything else that you want to share with the audience?
What do you think, Natasha? Anything else?
Education. Just education is a
Yeah.
huge key to everything, and work with wonderful people, and
Yeah.
we're lucky to do that.
Yeah.
All right. Well, great. Well, I'm looking forward to diving into more detail, both at the HCBS conference and in an upcoming webinar, and with the printed materials that we'll share, telling more about UDS's story. So, thank you, and look forward to some more.